Being a PI gives you responsibility for the conduct of the study and the leadership of the study team at your site. Essentially, this means that your priority is ensuring the health and safety of participants and the integrity of the study itself. It can be a challenging experience, but is also a highly rewarding one. The challenge comes from being responsible for all elements of a research study and ensuring that the study protocol is correctly followed. This is vitally important for the integrity of the study and the safety of participants. The reward comes from actively contributing to health research and improving outcomes for your patients and supporting your colleagues to improve practice. As a PI, you will recognise that there are many different ways that studies can be designed and delivered across health and care settings. These differences can influence how you approach the role and the activities that you undertake. For example, the overall management and oversight of a simple questionnaire will look very different to that of a clinical trial of an investigational medicinal product. Also, you may be responsible for leading a study team who undertake much of the day-to-day delivery of the study themselves, or you may undertake much of this activity yourself. In any case, you still have overall responsibility for the oversight and conduct of the study. This means that you need to be aware of common requirements for all research studies and take into account the following considerations. Before a new study can open to recruitment, you should determine whether your organisation has the capacity and the capability to conduct the study at your site. This means that you should feel confident that you have everything you need to deliver the study, including the necessary staff, equipment, and patient population to meet the study requirements. For example, you need to ensure you have sufficient research staff with the relevant skills, training, and experience to carry out the study. This may include arranging training and development for staff. You may also need to plan cover for periods of leave, sickness, and out of hours where necessary. You will also need to engage with and make arrangements for any additional services such as pharmacy and radiology, and ensuring that these are fully able to support the study. Finally, and very importantly, you will need to understand the demographics of the patient population to make sure that there are sufficient potential participants to meet the study requirements. The capacity and capability assessment ensures that all of the relevant considerations have been made and that a study can be conducted to time and target, taking into account the boundaries of the study protocol and the resources available at the study site. This gives you the opportunity to confirm the readiness of the site for the study. It also allows any protocol or study-specific training to take place. Effective capacity and capability means that you will be aware of the appropriate regulatory and legislative requirements for the study and ensure that the appropriate approvals are in place. Most study activity can be delegated to members of your research team, but oversight of this remains appropriate and your responsibility. As the PI, you are responsible for maintaining the study delegation log, which must record all delegated study activities and who is undertaking them. You will therefore need to ensure that staff are suitably experienced and trained to undertake any duties delegated to them, and that this evidence is in their CVs, training logs, or in any training certificates. Another critical responsibility is the oversight of participant safety and the integrity of the study throughout. You must keep clear documented evidence of this. This is a crucial element of any PI's responsibility because it provides assurance that the study is being conducted safely and ethically. This will include oversight and maintaining records of the following activities. Considerations around patient safety and study integrity include eligibility assessment and informed consent, not recruiting participants outside of agreed recruitment windows, applying protocol amendments. Where amendments are made to study documentation or procedures, you must confirm that the site still has the capacity and capability to conduct the study and ensure that the study team are aware of the changes. overseeing any adverse events or reactions and ensuring all necessary paperwork is completed and signed off, overseeing protocol deviations and violations, and ensuring appropriate action is taken, including any necessary retraining of staff, reviewing safety information from sponsors and other sites and taking appropriate action, conducting participant visits, updating patient health records, and finally, maintaining data security, for example, GDPR. Some considerations around leadership and management include attending site initiation visits and other relevant meetings, including monitoring and audit visits, holding regular update meetings with the study team, engagement with local research and development teams, maintaining the site file, keeping all study-related paperwork complete and up to date, including consent forms, approval documentation, adverse event reporting, protocol updates, case report forms, meeting minutes and other relevant correspondence. The PI should also have oversight that the participants' electronic health records are being correctly updated with the study visits and procedures within the study. This can be demonstrated by including a progress note on the health record to show that records have been reviewed. The proportion of participants and frequency review can be determined by the PI at the outset of the trial. On audits. On occasion, your study may be audited by the sponsor, a regulatory authority, or by your own organisation. As the PI, you must engage with the auditor and your R&D department to prepare for the audit. You will also meet with the auditor and ensure that any findings are actioned and rectified and respond to any subsequent correspondence. Once your site's role in the study is finished, you will oversee the site close down and end of study procedures. This may include engaging with your R&D department about requirements to close the study safely and archive the study documentation. This also means making sure that participants are not recruited following the end of the approved recruitment end date. So in summary, good research must be supported by an actively engaged PI who provides vital leadership and oversight to studies to ensure that protocols are correctly followed and the studies are completed to time. PIs are supported by a wider research and development team who are dedicated to achieving the study goals. Most importantly, PIs add to the body of research knowledge and have a fantastic opportunity to improve health outcomes.